Welcome to today's edition of the ILO's Global Discussion Series entitled Investing in OSH Infrastructure. My name is Kevin Cassidy. I'm the Director of the ILO Office for the United States based in Washington, D.C., and I will be your moderator for today's conversation with our distinguished experts. Today's event will be recorded and available on the ILO USA website for reviewing subsequent to the event. This discussion comes at a critical time as we look at the profound impact of COVID-19 on the world of work. It's an opportunity to invest in and build resilient OSH systems that address not only new threats to workers' safety and health, such as COVID-19, but also highlights the continued need to reduce the nearly 340 million occupational accidents and the 160 million victims of work-related illnesses annually across the world. We will start today's programs with two video messages. The first will be delivered by U.S. Secretary of Labor, Martin J. Walsh, and this will be followed by the Canadian Minister of Labor, Philomena Tassi, Member of Parliament.
Hello, I'm United States Labor Secretary Marty Walsh. I want to start by thanking the U.S. global partners for their commitment to keeping workers around the world safe on the job, especially during this pandemic. Thank you to the ILO for hosting today's World Day for Safety and Health at Work event. And thank you to everyone for coming together in a time of stress and uncertainty to work together on global solutions for workers' health and safety. In the United States, today is Workers' Memorial Day. This day means a great deal to me. I grew up working construction, and I was involved in the labor movement. I've known too many people who got injured and even lost their lives on the job. And I've seen the toll it takes on families. Those workers and their families are always in my heart. America got through this past year thanks to the dedication of frontline and essential workers. Nurses and doctors, home healthcare workers, grocery store clerks and delivery drivers, farm workers and meat packers, and so many more. Our nation learned all over again that we depend on working men and women for our health, for our safety, and for our communities. So I'm proud of the work we are leading in the U.S. and around the world to protect workers' lives and livelihoods. I'm proud of the work of the G20 OSH network to share best practices for safety and health in the workplace. I'm proud of the work done by this group to develop a strong, worker-centered statement on building back safer and healthier for this year's G20 Labor and Employment Ministers Declaration. The Biden-Harris administration supports the work of International Labor Organization to improve occupational safety and health. We also strongly support including safety and health in the ILO's framework of fundamental principles and the rights at work. We look forward to working with friends and partners to make these goals a reality. Today and every day, we remember and honor those we have lost, and we will not stop fighting to protect those who are living. Thank you for your partnership in this work.
Hi, I'm Philomena Tassi, Member of Parliament for Hamilton West Ancaster Dundas and Canada's Minister of Labour. I am very pleased to speak to you on behalf of the Canadian government. I would like to begin by acknowledging that I am participating from the traditional territory of the Haudenosaunee and Anishinaabe peoples within the territory covered by the Upper Canada Treaties, as well as the Dish with One Spoon Wampum Agreement. First, let me thank the International Labour Organization for giving me the opportunity to speak to you today. Canada is proud to be an active member of the ILO and fully supports that safe and healthy working conditions are fundamental to decent work, as stated in the ILO Centenary Declaration. The World Day for Safety and Health at Work is a time for employers, workers, partners, and the public to focus on the importance of preventing injury and illness in the workplace. It is a time to encourage people to get involved, spread the word, and incorporate safe practices into their daily work. While the world is dealing with COVID-19, it is also an opportunity to raise awareness and stimulate dialogue on the urgency of mitigating and preventing the spread of the virus in the workplace. During these challenging times, important protections have been put in place in our country, but we are still not out of the woods. For example, we've created new job-protected leave related to COVID-19, increased outreach efforts to employers to remind them of their responsibilities under the Canada Labour Code, and provided reliable, up-to-date information and resources on our website. As we work towards an economic recovery that is fair, safe, and inclusive, we're making sure that mandate commitments remain at the forefront of our work. These include commitments to prevent harassment and violence and to ensure that mental health is a key element of occupational health and safety. In recent years, the Government of Canada has significantly modernized the Canada Labour Code and its compliance and enforcement provisions. Today is also an important day for Canada. 30 years ago, we passed Workers' Mourning Day Act, making April 28th an official day of mourning. Since that day, every year, we pause to pay our respects and remember all workers who have lost their lives, been injured, or suffered illness on the job due to a work-related tragedy. This year, we also reflect on and mourn the tragic loss of workers because of COVID-19. The health and safety of all workers across the country is not just our responsibility, it's our priority. That's why today we renew our commitment to improving the health and safety measures in workplaces to prevent injuries, illness, and death. I encourage everyone to continue working together to build a healthier and safer workplace.
On behalf of the ILO, we are truly grateful to Secretary Walsh and Minister Tassi for their important messages and greatly appreciative to our colleagues in the U.S. Department of Labor's Bureau for International Affairs and the colleagues in the Employment and Social Development Canada for their efforts to secure these video messages. Thank you so much. Now it's my pleasure to begin the discussion with our experts. Each speaker today, who I will introduce as we move forward, will provide an overview of occupational safety and health, the key issues at play, the challenges for greater protection, as well as the priorities and the way forward from their unique perspective. At this time, it is my honor and pleasure to introduce Mr. James Frederick, Acting Assistant Secretary of Labor of the Occupational Safety and Health Administration of the United States Department of Labor. Mr. Frederick, the floor is yours, sir.
Thank you, Kevin. Thank you for the introduction, and thank you for inviting me to participate in the discussions today. Ensuring that workers have safe and healthy workplaces is a universal challenge, not confined to one country or one occupational sector. Every day, far too many workers and too many families have to face the harsh reality that a workplace injury or illness could take their life or the life of someone they love. The truth is, they shouldn't have to, as workplace injuries and illnesses are preventable. This is why on this date every year, we commemorate Workers' Memorial Day to remember and honor those lives that have been taken by a workplace injury or illness and recommit ourselves to do everything in our power to prevent others from suffering the same terrible fate. Today is also the 50th anniversary of when the U.S. Occupational Safety and Health Administration, or OSHA, first opened its doors. Many improvements have been made in workplace health and safety in the United States over the past half century, but we also know that our work has really only just begun. Workers continue to be sick or killed on the job, and as the COVID-19 pandemic has shown, our agency's mission is important as ever. Protecting workers' lives has taken on a new urgency in the past year as the world has dealt with the COVID-19 pandemic. President Biden has made combating the pandemic and protecting workers from COVID-19 a priority for his administration. On his first full day in office, President Biden issued an executive order laying out actions for OSHA to take in improving worker protections from COVID-19. In the first 100 days of this administration, we've taken action to implement the president's executive order and better protect workers from the virus. On January 29th, OSHA issued updated, stronger guidance, providing a roadmap to help businesses decrease risk and improve worker safety so they can reopen and stay open safely. On March 12th, we issued a national emphasis program for COVID-19 enforcement and revised our approach to focus our enforcement efforts on workplaces that put the largest number of workers at serious risk of contracting the coronavirus, as well as employers that retaliate against workers for complaints about unsafe or unhealthy conditions. Just on this past Monday, we sent a draft COVID-19 emergency temporary standard to the White House Office of Management and Budget for review. OSHA has been working diligently on its proposal and has taken the appropriate time to work with our science agency partners, economic agencies, and others in the US government to get this proposed emergency standard right. As we continue working to protect workers from COVID-19 and toward ending the pandemic and getting our lives back to the new normal, we have to think about how to improve workplace safety protection to meet challenges ahead. It is imperative that we as safety and health professionals and leaders work together to make sure that we're prepared for the next health and safety emergency or crisis. Collaboration across borders and across oceans can help save lives, reduce injuries, and make workplaces safer and healthier all around the world. We must emphasize and encourage the implementation of comprehensive health and safety management systems characterized by a high level of commitment from management and active participation by workers, which are necessary to successfully prevent workplace injuries and illnesses. All workers have the right to a safe and healthy workplace and to speak up about hazards without fear of retaliation. Discussions like this that we're having today can help us share ideas, good practices, and approaches to making this a reality for every worker across the globe. I look forward to our discussion. Thank you.
Mr. Farag, thank you very much. I really appreciate your important words on OSH and look forward to drilling down a bit deeper into some of the issues. And again, thank you for making time. I was really surprised and happily surprised to see the scores of events that OSHA is hosting around the USA right now. And also moved by the reminder on your organization's website and your comments that today is known as Workers' Memorial Day. Knowing that we are paying respect to those who have lost their lives on the job, especially those essential workers, those frontline workers who are every day exposed to COVID-19, and the millions, of course, who have lost this battle. Thank you, sir. Our next expert is Kathy Feingold. Kathy is the director of the international department at the AFL-CIO, who works tirelessly, and I know that because she's always working to improve the lives of working people nationally and internationally. Kathy, the floor is yours.
Thanks so much, Kevin, and thanks to all the colleagues at the ILO for organizing this event and for continuing to raise this important issue. As you mentioned, Kevin, today is Workers' Memorial Day, and today takes on an even more urgent feeling as we grieve the hundreds and thousands of workers whose lives have been lost as a result of COVID-19, in addition to the many lives lost due to weak occupational safety and health protections. We grieve the nearly 600,000 lives lost to COVID in the US, the over 3 million lives lost globally, and the tens of thousands of people suffering with COVID and its effects today. In particular, we send our solidarity out to the families who continue to grieve, and the families, especially in India and Brazil and so many countries where the pandemic runs rampant. But this pandemic continues to highlight the inadequacy of occupational health and safety measures at the level of the workplace, as well as a number of global and national governance gaps, which we need to address immediately. Each year, the AFL-CIO documents the number of workers who continue to die on the job as a result of occupational safety and health. Next week, you'll be able to see this report. It will be coming out. But as many people know who follow this issue, last year, we reported that 5,250 workers lost their lives on the job as a result of traumatic injury. So this is in addition to the pandemic. We continue, as we heard from Secretary Walsh, to have a real problem in workplaces. And we know that the workplace deaths also underscore inequities throughout our country. Black and Latino workers in the US had higher job fatality rates than all other workers. 66% of the Latino workplace deaths are among immigrant workers. This also highlights the other issues we're working on in the labor movement, the need to make sure that workers can organize, can speak out, exercise their rights. And that's why we're supporting labor law reform through the PRO Act. Under the law, we know that every employer is responsible for providing a safe workplace, but each year, far too many people continue to be killed. So what do we want to see have happen this year? First of all, I was glad to see that the Secretary himself raised the issue. We need to recognize occupational health and safety as a fundamental right for workers. Making this a fundamental right, drawing on the ILO's existing key conventions in the area, would first of all place an obligation on ILO member states to adhere to this issue, to make sure that OSH is front and center in their programs, in their legislation and practice. It would also encourage greater recognition for the rights that have been set out for years in these conventions. And we know here in the US, it would build OSH into trade agreements, multilateral agreements like World Bank and Regional Development Bank rules, WHO guidance. So this would really signal the important leadership that the ILO has to play on this issue. Secondly, COVID must be classified as an occupational disease. I don't think I need to say it to this group here. This would provide enhanced protection for workers and enable access to compensation funds for families of workers who've been impacted by COVID this year. And we know there's many people who are going to be long haulers, and we need to really adapt our programs and policies. Third, we need to consult workers about best practices. They know best how they're going to feel safe in their workplaces, whether it's masks, whether it's distancing. There's a lot of expertise in the workplace. Let's draw on workers so that they can help work with management to end the pandemic. We need better reporting, notification, and compensation for workers who've been injured during the disease. We need people to ask the question when you go to the doctors and you're ill, they should ask, what work do you do? Often that's never asked for those of us who go to the doctor. How often are you asked, what do you do? So that we can link whether or not your illness is part of what you are doing day in and day out in your workplace. We also need universal social protection. And I love saying that because here in the United States, we're talking about some new proposals coming forward out of the Biden administration, but we need universal social protection as a floor that would provide leave for those who are sick or injured or who have communicable diseases and need isolation or quarantine. So I can speak further to this during some of the questions and answers, but I think having this floor of universal social protection, the labor movement supports at the G7 level, the creation of a global social protection fund for the poorest 28 countries. And I'll end by saying here in the US, labor, business, and the development community is coming together to advocate for increased funding for social protection programs, because we recognize if we are going to get ourselves out of this pandemic, we're going to organize to change what's happening to workers in terms of occupational safety and health. All workers need rights, all workers need floors, and we need to increase our attention and funding to universal social protection. Thanks so much again for highlighting this issue on Workers' Memorial Day. Back to you, Kevin. Thanks.
Kathy, thank you very much. I always enjoy hearing you speak because I learned so much. So really, thank you for my continuing education. So appreciating that. And during our discussion, I think the audience would like to hear a little bit more about the social protection floor and what that actually constitutes. And also maybe a little bit about your thoughts and plans regarding President Biden's recent executive order on protecting worker health and safety. Clearly, we must continue to prioritize safety and ensure workers are protected from COVID-19 and other emerging pathogens in the world of work. I think we all know that this is not the big first and not the last. So thank you very much. At this time, I'd like to introduce Mr. Tom Mackel. Tom is the Senior Counsel for the U.S. Council for International Business, USCIB, and is the U.S. employer member of the ILO's governing body. Prior to joining USCIB, Tom was the Group Vice President of Global Labor Relations at Sodexo, a leading provider of food and facilities management and services. So Tom has a lot of very practical experiences as an employer working on these issues. Welcome, Tom, and the floor is yours, sir.
Thank you, Kevin, and thank you to my colleagues for participating in this event that the ILO so graciously hosted on this very important day of remembrance. The USCIB represents U.S. employers globally to the International Organization of Employers and the ILO, and protecting workers' health and safety at work and ensuring business continuity to protect employment are really top priorities for employers. Certainly, as reflected in the Centenary Declaration of 2019 and as acknowledged by Canada's Minister of Labour, safe and healthy working conditions are indeed fundamental to decent work. The pandemic has laid bare that working assumptions about what are safe and healthy working conditions may be upended in a relative instant. and that the ability to adapt to environmental change can be essential to protecting both occupational safety and health and the employment that depends upon business continuity. OSH infrastructure, which we see as sustainable and effective occupational safety and health systems, has to include appropriate global standards that can and will be adopted, implemented, inspected, and enforced by local governments. The adoption and implementation and enforcement is so critically important to the work that the ILO does and to ensuring that there is indeed a global system of occupational safety and health protection upon which so much of our commerce and supply chains depend today, and frankly, that workers around the world deserve. It is critical that we learn from the disruption that this pandemic caused and that we encourage the adaptation and innovation that has arisen out of it. This includes the assessment of the value and continuing effectiveness of very basic workplace changes like barriers, spacing, new PPE, ventilation, sanitation, and even testing and tracing, not because we are trying to simply go after COVID, but as we continue to look at how to address the threat of emerging pathogens that may threaten worker health and safety in the workplace. I think just as importantly, we have seen an acceleration of fundamental change in the nature of some workplaces, whether that's teleworking, insufferable Zoom calls, digitization of points of contact, increased role of logistics, and changes in business models, and all the changes in work habits that go along with this. Proper investment in OSH infrastructure must include assessment of these changes and support for innovations that can simultaneously promote occupational safety and health, productivity, innovation, and business continuity, even as we face new threats. In the immediate term, to protect occupational safety and health and ensure business continuity and recovery and the decent work that follows from that, we need to crush this pandemic. The most direct path to that is by vaccination. In addition to the occupational safety and health measures that have been implemented and that have just been mentioned. But it's interesting that widespread vaccination sufficient to achieve herd immunity is threatened by vaccine hesitancy. And we believe the business is a critical voice in the necessary push from vaccine hesitancy to vaccine acceptance. According to the 2021 Edelman Trust Barometer, business is more trusted globally than even government, NGOs, and media. And leveraging this trust and the reach of global business is essential. Doing that, leveraging this trust and the reach of global business partners to convince is an initiative of the USCIB Foundation and has brought together a coalition of large global business networks around the world to promote vaccine literacy and uptake among employees to get vaccinated when vaccines become available. To date, these organizations include the International Chamber of Commerce, the International Organization of Employers, Business at the OECD, and many others. Together, these organizations represent more than 100 million companies, large, medium, and small, in over 100 countries. The path of these global is twofold. Their members trust them, and their members employ hundreds of millions of workers. By working with business networks all over the world, we can scale quickly and achieve our goal, which is a global movement among employers to encourage employees to get vaccinated on a massive scale. And we invite our government, worker, and organizational partners to join us in that. Thank you, Kevin.
Tom, thank you very much for those insights and for USCIB's contribution to this discussion internationally. It really is greatly appreciated. I believe business research does show that safety and well-being at the workplace equals good business, as well as productivity and profitability. So I think we're all in this together. This pandemic really has highlighted the need for sound and resilient OSH systems firmly in place to protect the workers' safety and health as work, as well as to support the survival and business continuity of enterprises. And we look forward to hearing more about this in our discussion. Now, I'd like to welcome and introduce my colleague, Joaquin Nunez, who is the chief of the ILO's Labor Administration and Labor Inspection and Occupational Safety and Health Branch. He has just finished speaking at the ILO's global event in Geneva. Joachim, I wonder if you could give our audience an overview of the main points of the new report with a title that is very much a clarion call, namely Anticipate, Prepare, and Respond to Crisis. Invest now in resilient OSH systems. Joachim, I look forward to your presentation.
Thank you, Kevin. And first of all, congratulations for organizing this important event in the Americas. I would like to build on what other colleagues have said, which will make it easier for me to convey the two main messages that we want with this year's Safe Day. As you know, Safe Day, or the World Day for Safety and Health at Work, is part of the ILO's global strategy for occupational safety and health. And we always try to select every year what would be the most important topic when considering what we see around the world as being the major challenge for the safety and the health of workers and sustainability of enterprises, of course. So, and of course, that this year we could not select other topic that it wouldn't be related to COVID-19. But as we already had COVID-19 last year, we started thinking that, and of course, this is obvious what I'm going to say, that COVID-19 is a catastrophic event that we have already for more than a year, but it's not the first one that we have. It is not the first pandemic. It will probably not be the last pandemic that we have, and we will have also other disruptive events, being these epidemics that may affect the region, being these serious major industrial accidents, being this any other uh, public health crisis that may affect workplaces that we have to consider. And by saying this, we have to recognize that safety and health, it is very important to address the current challenges we have with the COVID-19, but it will be important also in a way to be prepared for the upcoming challenges that we'll have and that we will surely have. So the first idea that we want to convey is that occupational safety and health is core not only to the health and well-being of workers, but again, it is core to the sustainability of businesses and even to the sustainability and normality of social life. And in order for this, for the objectives that we want to achieve by having a strong and resilient national occupational safety and health system, we need to invest. We need investment. When we say we need investment, it's not only investing financially, it's investing programmatically. It's investing in the capacities that the different institutions have. And out of my own experience, and I'm not referring now to the US, of course, I have seen that in most of the countries, there is always a weak link when you think of national occupational safety and health systems. And I think it was Kathy that mentioned that sometimes we go to the doctor and they rarely ask us, if the disease that we have is somehow related to the work that we do. And this is something that we find quite often in, almost all the countries, developed and developing. For instance, there isn't enough capacity in terms of having qualified health professionals that know on how to, make the relation between what we have as symptoms that could be related to a disease and the operations that we perform out of our professions. So the second idea, so the first idea is the need to invest on all the different elements of the national infrastructure for occupational safety and health. And the second idea is that, we have to think of the system as a whole. And, the idea of system says it all. You cannot only invest in terms of modernizing or adapting your national legal framework or having a new policy to address COVID-19. No, if, for instance, your policy is not based on accurate data, on rates of infection, or when thinking of COVID-19, of course, or how COVID-19 is affecting different industries, regions, or even groups of workers, of course, your policies not being evidence-based will be necessarily weak. Also, if your policies are not consulted with social partners, it is highly probable that the levels of trust when implementing these policies will lead to potential challenges. So this is the second idea that we want to convey with Safe Day this year. So think of the national infrastructure for occupational safety and health as a system where we have to invest in all the different elements. And this is also why, if you have the opportunity to read the safety report for this year, you'll see that the report is developed in different chapters, and each one of the chapter addresses what we consider to be one of the main elements of a national system of occupational safety and health. So national regulatory policy and institutional frameworks, structures for social dialogue, occupational health services, very important this one because we saw also out of a recent research that even in industrialized service countries, occupational health services, which are the specialized services to provide assistance to employers, do not cover more than 50% of workplaces, of businesses, and other elements of the system as well that you need to consider, such as, of course, education, information, and advice to the workplaces, enforcement that was mentioned here, research, etc., etc. So this would be what I'd like to say to start this dialogue, Kevin. Thank you.
Yoki, thank you very much for that overview. The report that was referenced is now available on the ILO's website, and that can be found at www.ilo.org. Now, I'd like to engage all our speakers in a dialogue with a series of questions and on the safety and health nationally, internationally. I would ask the speakers to keep their replies to about 1 to 2 minutes so we can address a full range of issues with the distinguished panelists. Please feel free to jump into the conversation, the panelists, of course, if you feel that you have more to add to the question. So I'd like to start with Kathy. And Kathy, both your role at AFL-CIO and as the deputy president at International Trade Union Confederation, the ITUC notes that 7,600 workers die of workplace accidents and diseases every day. Healthcare workers worldwide are dying at the rate of 1 every 30 minutes from COVID-19. I mean, these are incredible numbers. So what are the key challenges in the US context for those frontline workers? And what are the systems that you are recommending internationally to address health and safety in the workplace?
Thanks so much, Kevin. And whoa, to respond in 2 minutes, but one of the really big challenges we had when COVID initially hit is we did not have standards in this country. We were unable to get an emergency temporary health standard. And Jim mentioned that now it's moving and it's at the White House. But in the previous administration, when the pandemic first hit, there was no real effective guidance, and we don't. And you have to move guidance into standards so that there's some accountability and enforcement to it. But that is why we are so happy to see an emergency temporary health standard moving in the United States, so that we can finally give the needed information to employers to supply their workers with masks, and that they have a written plan to avert exposure in the workplace. And this national, as Joaquin was saying, is also part of the global, right? We need this to be a standard. Guidance is great, and we appreciate the CDC's guidance. It's super important. We get new guidance every day that gives us all kind of whiplash, but a standard means it's enforceable and there is accountability. That's what we want to see at the national level. The failures at the national level in the United States meant that states like Virginia, Oregon, Washington, and a few others have moved at the state level. We need a floor. Every single worker needs to go to work, whether you are a beady roller in India or whether you are a sheet metal worker in the United States. You need to know that your employer is going to ensure you are in a safe and healthy workplace.
James, if I could then take up with that point, I mean, you, before your appointment to this position as the acting assistant secretary, you've worked nearly 3 decades with the United Steelworkers Union. So you really have been on the front line in negotiating and interacting on national, international health and safety management systems. How do you see from your experience and working on ISO 45001 as well as other systems, and what do you see as the road ahead for the U.S. government in moving beyond just the guidance?
Yeah. No, so thank you for that, Kevin. And specifically on health and safety management systems, a couple of points that are important to start from are the fact that health and safety management systems exist in workplaces. Sometimes neither the workers nor the employer recognizes them, but they are there. And so one of the very important preliminary steps is to do a lot of education and outreach to let employers and workers and government entities recognize and understand the importance of health and safety management systems, the common elements of an effective health and safety management system, and then build upon the existing systems and formalize them in a maturity model. The more mature health and safety management systems can be, the less risk to workplace injury and illness workers will have. And so where we have had both personally firsthand experience while working with the Steelworkers Union, and now in 3 months and 8 days at the Occupational Safety and Health Administration, we certainly see a very and vital important role of a comprehensive health and safety management system approach to all workplace health and safety hazards, inclusive of those that we were talking about just now.
Right. And with that, I'll turn to Tom now. I mean, Tom, you've worked in a big company. You know the importance of putting these systems in place. Yet COVID, it presented a lot of challenges, for businesses to respond. Can you speak a little bit about some of the lessons that have been learned and some of the innovations maybe that businesses are making in order to have lasting change moving forward?
Thank you. So let me build upon what my colleague just spoke about the health and safety management systems, because I do think that that they do exist. They exist. They're widespread. Business invests billions of dollars every year in health and safety management systems. As you said, Peter, it is not just it's good business. Certainly, in my experience, improving health and safety, every tick of improvement of health and safety in the workplace, of lowering lost time, lowering incidents, was a direct benefit to the bottom line of the company. And certainly, I think that the fundamental lessons that I think the pandemic shows, they're the lessons that we've known all along. A system depends upon everybody from top to bottom having a health and safety mindset. There's a very common model of health and safety, what's the Swiss cheese model, where in order for an accident to happen, an unsafe condition to result in an accident, there has to be an alignment of gaps in layers of protection that are in place by health and safety management systems. And at each point along the way, whether it is a worker, a manager, or anybody else who's part of that, can take steps in order to move the barrier so that the holes no longer align and the outcome of an accident is not going to happen. The point is that health and safety is a collective responsibility in the workplace. It is absolutely essential for employers to create a health and safety culture that is supported by a health and safety system. What has COVID-19 shown us? Perhaps we have focused more heavily upon working conditions, not the issues of workplace pathogens. And certainly, COVID-19 has demonstrated, I think, the importance of paying attention to workplace pathogens and workplace illness. But the lesson remains that it is up to everybody from frontline to back of the house to management to executives to ensure that there is a culture of support for the health and safety systems that are in place.
Tom, thank you very much. Before I turn to Joachim, Kathy, there was a question from the floor that was asking about the classifying COVID-19 as an occupational disease. I wonder if you can just respond to that query from our audience.
Absolutely. We we believe the labor movement, both in the US and globally, think that it should be classified as part of occupational safety and health. It leads to greater accountability, access to compensation. It shouldn't be restricted to sectors. Obviously, you can get it in the workplace and outside the workplace, but there is a lot that has been documented about workers getting sick in the workplace. So, yes.
Great. Thank you for that clarification, Kathy. Joachim, the report this year, it is very much focused on investing in OSH systems and integrating this into a national crisis emergency preparedness response. Can you give us a couple of examples of what this might look like on the ground? And, what are the countries that are doing this particularly well?
So thank you for that question. I would say that again, and I'm also happy to see that several colleagues here have brought up the idea of system. You need to consider that countries also operate as a system when it comes to public health and occupational safety and health. So we cannot separate these two. So it means that whenever you're developing or preparing a national emergency plan, occupational safety and health has to be part of it. And the opposite, when you're developing a national OSH policy or program, of course, you have to include there all that has to do with emergency preparedness. And the same happens, of course, at workplace level. One of the things that we see quite often before going to the good practices, and I'm picking up what Thomas has said, is that we know, especially when we work with occupational safety and health, that it's always more difficult to tackle all that has to do with the health component of it than most often the safety part of it, and namely when it comes to the recognition of the disease, etc. And this is something that we all know. Um, and again, this is also why when considering national policy or workplace policy, again, you have to consider, the whole of the different factors that can lead to injury or a disease or fatality. And this will be related also to, in many cases, on to the question on how do you prepare and respond to emergencies in a given company or in a given region. And I'll give you the example. Let's not think of COVID-19. Let's think, for instance, of the catastrophic accident that occurred in Beirut not so far ago. So how can you be prepared as a country or as an enterprise to not only hopefully to avoid that kind of accident, but then if this happens, how to react, accordingly, in an effective way, in an efficient way, so that you will try to limit damage as far as possible, and you'll also bring protection to all those that were affected also as efficiently as possible. In terms of good examples, I never like to make references to specific countries when I have these live events. I would invite all colleagues here in the audience, of course, to read our safety report, and you will find many of these examples there. It's available online. I just, wrote the exact link where you can find this document. There's also a leaflet, which is a summarized version of the report. And again, you'll also find at the end of the report a very complete table with national examples on how countries have reacted and are reacting in terms of COVID-19, also in terms of emergency preparedness. Kevin, thank you.
To everyone out there viewing this from the LinkedIn platform, you are listening to the ILO's Global Discussion Series on investing in OSH infrastructure. And any questions you may have, please send them to us through the chat function. I'd like to open up a question to the floor. And I often think when I'm speaking to students or others about the work we do internationally, a lot of them, may not get it. They don't say, well, what has it have to do with my life? How does that impact upon me? I'm okay. I have my PPEs. I'm all right. Why do I have to worry about occupational safety and health, even if it's COVID-19? And I think about supply chains. And I think Tom and Kathy, the International Organization of Employers and the International Trade Union Confederation both came together at the very beginning for a call to action because the current, sort of global value chains where you have international buyers and local suppliers, you can place all the orders you want, but if you don't have the people who are healthy enough to operate the machines, to pack the boxes, to put it on the ships, to the mariners to sail it around the world. I mean, it really is a complex issue. I wonder if I could open that up to the group to speak a little bit about how something like this ripples out into the rest of society.
Sure.
Do you want me to? You just want us to jump in, Kevin?
Yes, please. If you would jump in, Kathy, and maybe Tom, if you would maybe jump in as well after Kathy.
I mean, I think the supply chain issue, absolutely. Let's be clear, from a labor movement perspective, the way supply chains were organized was already quite precarious. And I think we talk about, I like that we were using the word, we need collective response. And the labor movement for years has said, if you want a collective response, you have to be able to have collective power at the workplace. You have to have workplace democracy. If workers feel like, you mentioned the Bangladesh Accord is your next conversation, if workers feel like they know something is unsafe, but they're going to be fired if they speak out, then that is a serious issue. So I think around the world, we have seen for many years the way supply chains were built, whether it was around weak labor standards, weak workplace protections, weak OSH protections. We know there have been fires, there have been collapses of buildings, there have been problems with chemicals and workers fainting. So just to say that what we had pre-pandemic was already a fissured workplace that created lots of challenges to kind of address the needs that workers have. What I think the pandemic has shown is how much we really do need a collective response. You are right, Kevin, business and labor have come together around issues. When consumer demand plummeted, I think businesses saw what happens in supply chains, but we have to be clear what happened in the supply chains is workers were sent home without severance. Over 60% of the world's workers have no social protection. They had no income support programs. They had no health care. So we were already dealing with a system that failed workers. What we have to do now, take what we've learned from the pandemic, from the previous failures, rebuild differently. What are the strategies we need as workers, as business, to make sure we have resilient supply chains, resilient economies that work for business as well as labor?
Peter, look, as I said it at the start of my comments, I think a sustainable and effective OSH system includes appropriate global standards that can and will be adopted, implemented, inspected, and enforced by local governments. From our perspective, the capacity of host governments to inspect, to enforce what are clear standards across the board certainly is essential to safety and health throughout global supply chains. I mean, look, the facts are that employees in host countries who are part of global supply chains generally find themselves with higher wages and with better conditions than folks who are part of purely domestic supply chains. So there's already benefit from the economic push that comes from the global investment. We need local governments, host governments, to have the capacity to not only have standards, but to implement, enforce, inspect those standards. This rule of law is critically important. And this, frankly, is where the ILO, in addition to workers, in addition to employers, in addition to governments, where the ILO can really play, I think, a very valuable role in the capacity building that it has expertise in, when it works with host governments.
Kevin, if I could throw in just a couple of additional comments. Starting from the perspective that today is the 50th anniversary of OSHA opening their doors for business in the U.S. It is important, but we certainly have stepped back of recognizing that anniversary because this is also Workers' Memorial Day, and particularly in the context of what has been experienced in the last little bit more than a year, it is much more important to focus on that today, and there'll be time to talk about it moving forward. But I think that it's important to recognize that 50 years ago, the people that put together the OSHA Act themselves focused somewhat on related to the question that you started this conversation with of the successful supply chain in occupational safety and health in the United States is based on people acting collectively in the workplace to ensure safety and health. And one important example of that, looking at a specific workplace is that a worker doing work with a chemical compound and making certain that they are not creating excess dust that is exposing other workers down the production line is very important. And that all then relates back to some of Tom's earlier comments about the necessity for workers and employers to be engaged and involved in health and safety in the workplace in order for it to be successful. And also his comments of the importance of the ability for government entities to enforce the rules that are in place. And all of that is truly a system like the systems that are being discussed in the report today. And it really is knitted nicely together in the context of this specific question that you asked. And I think that at least from the US perspective, we have more work to do. There certainly are gaps in each of those elements that we just discussed, that we have more work to do. We need additional resources of enforcement because in the US, we certainly do not have enough enforcement resources today to reach every workplace. And that's one of the reasons, again, going back to the collective nature of workplace health and safety, that we need workers to have the voice in order to feel comfortable and confident to raise the concerns to their employers, to their coworkers, and to the government, to OSHA when necessary. So just a few more thoughts on that.
That's excellent, and it really reaffirms, what myself personally, my colleagues would believe, that you can't do this alone. I think it has been echoed here that we work together at the ILO in the tripartite manner. So governments, workers, and employers sitting down, communicating what the issues are, trying to find resolution. Compromise is not a dirty word. It's a way in which we move forward. So I think really quite important. Joachim, I'm going to ask you the last question before we wrap up today's discussion. We were talking, and we heard Secretary Walsh earlier talking about support for the ILO's framework of fundamental principles and rights at work. And what we're speaking about here is that interconnectedness. And so how do you think that your particular operation within the ILO or the ILO generally can help build better cooperation? And what are the key areas that you hope that we can take away from this today and really start moving forward?
Thank you, Kevin. And before going there, I'd also like to, add, a very quick comment to the question you had before, just to say that as Kathy and Thomas and James referred somehow to, shared responsibilities. So in terms of washing global supply chains, I would like to say that, we have a specific program in the ILO. Well, it's a fund called Vision Zero Fund, which works with global supply chains. And the model that we follow, it's what we call the model of collective action for OSH improvements. And this means that, of course, we require the action according to the different responsibilities of governments, of employers and workers, in line with what the international labor standards, say about it, namely Convention 155 and 187. It's a model that not only tries to bring positive change at workplace level, but also build institutional capacity at governmental level in terms of all the institutions that should work with enterprises to improve OSH conditions, namely, as some colleagues here mentioned, the labor inspectorates. Again, one thing that we cannot forget, and I know that we are all aware of this here, is that in many countries, in the development context, OSH institutions are very, very, very weak. And there's a serious need to strengthen the resources and the capacity of these institutions. And just to give you an example, before going to what you asked, Kevin, when I started working for the ILO, I can say that I was shocked when I started going to some countries, namely in terms of development cooperation projects, and when I saw the resources that these institutions had, and also the poor capacity of the officials. So again, this is something that it's a work in progress. When it comes to, of course, to how to best promote OSH in the global arena, again, we have a very solid framework of international labor standards that are a trusted source when it comes to the definitions of rights and responsibilities. So one of my first recommendations, of course, would be, well, ratify the standards, give practice to the elements that you find in the standards. And even if you don't ratify the standards for different reasons, please follow what we have in the standards as guidelines that were approved jointly by governments, by employers, and by workers. As you know, the ILO is a tripartite organization. Then again, we have a whole set of technical guidelines, codes of practice that apply to different sectors, different occupational hazards, and this again it's an important reference when thinking of work at global and country level. Then join us also in advocating for stronger occupational safety and health in countries. So join us, for instance, in efforts that we have in terms of coordinating global platforms such as the Global Coalition for Safety and Health at Work, because this really intends to bring to the forefront of the political debate the question of occupational safety and health. And then again, of course, as Thomas was saying, that the ILO has a very important role to play when it comes to assisting countries with less resources when it comes to the need further developing safety and health in workplaces. We also count very much with the international community to work with us in order to enable us to multiply the resources we have to provide this assistance to developing countries. So this would be what probably I would say, in a nutshell, Kevin. So a legal framework that applies everywhere, guidance, and also technical materials that we have that are usually available and applicable to any context. Of course, that need to be adapted to the local national circumstances, and also, of course, the practical work of the ILO, working with the institutions of work to give practice to what we have in our standards.
Okay, thank you very much. And we are coming to a close of the program. I'd like to give our speakers a chance to just give a final brief statement about what are the big issues or what is their big message to those today. So will you walk away with what each of these groups are talking about? So we're going to start in reverse order. Joachim, if you could just give us a brief, what is the big statement you want people to remember from this conversation?
Kevin, this is so important for me that I even wrote it down. So let me read it. So my message would be prepared. This is not an option. Let me go back to the motto of Safe Today: anticipate, prepare, and respond to crises. Invest now in resilient OSH systems. This is my message.
Well said. Tom, what is your big message to our audience today, please, sir?
We all agree that safe and healthy working conditions are fundamental to decent work. It's critical that we learn from the disruption this pandemic has caused and encourage the adaptation and innovation that's arisen out of it in order to protect health and safety effectively going forward, and to protect as well the continuity of business and the employment that flows from that. Thank you.
Thank you very much, Tom. Kathy?
Create the necessary global framework of OSH, make it a fundamental right at the ILO. We can do this. Business, labor, and governments, let's get it done. Let's have standards. Let's have both guidance, but we also need standards that hold employers and governments accountable. Make sure workers have their rights effectively enforced so they can speak about OSH without being worried about getting fired. Let's build that floor for universal social protection. And let's make sure throughout all of these processes, you're consulting with workers. Thanks so much.
And Assistant Secretary, you have the last word for today, sir.
Thank you, Kevin, and thank you again to the ILO for coordinating this and the invitation to speak. Just a couple of points. One is investing in workplace health and safety systems is important and vital and pays big dividends. Second, I know everyone across the globe is certainly laser focused on the COVID-19 pandemic. And while we need to retain that focus, we must also look at the entirety of occupational health and safety in order to make certain that we have built a resilient infrastructure for post-pandemic occupational safety and health. And we know that together, working with government entities, workers, and employers, we can achieve much of this. And we strive to do so that families and workers will feel safer about their jobs. And when they sit around their kitchen tables at dinner time and talk about work, it will be a much better conversation. So again, thank you.
Excellent. Ladies and gentlemen, we have come to a close of our program today. Please join me in thanking our speakers for their contributions to this discussion. James Frederick, Kathy Feingold, Tom Muckle, and Joaquin Nunez. Many, many thanks for your time and expertise, and clearly your passion and for safety and health of workers and workplaces all across the world. Also, special thanks to U.S. Labor Secretary Martin J. Walsh and Canadian Minister for Labor Philomena Tassi for their important statements and ongoing leadership. To our audience, thank you for your time. I trust you have found this an exciting and informative program. And please join us again, our ongoing global discussion series. Our next program will be on the 19th of May on Bangladesh at 50, the role of decent work in sustainable inclusive growth. Again, another important OSH issue there as well, too. And please visit our website at ilo.org/Washington to register for this event, where we will have a unique conversation and explore the National Tripartite Plan of Action and the way forward. I've enjoyed being your host. My name is Kevin Cassidy. Stay safe, stay healthy. Thank you all.